In this video, we're going to cover 3 key things that I think you need to know in order to optimize your recovery from knee replacement surgery. We're going to cover recovery in the hospital and at home. Secondly, we'll assess potential complications that I think you should be aware of. And finally, we're going to go over when to seek medical attention if these complications happen to arise. Now, it's also important to be aware that whilst I'm a registered doctor in the UK at the time of making this video, it shouldn't replace advice from your own health provider, and this video is intended as a general educational resource only. Now, before we get into the main section of the video, let's just briefly spend a minute discussing what knee replacement surgery is and what it involves. So, knee replacement surgery involves replacing damaged parts of your knee joint with metal or plastic parts. Now, it's most commonly used to treat pain and stiffness in the knee joint that's caused by a condition called osteoarthritis, which is essentially wear and tear of the protective cartilage that covers the bone. And typically, it may be recommended if other treatments or lifestyle changes haven't worked and the knee pain is affecting your daily life. Now, depending on the damage to your knee, it can be used to replace all of your knee joint, in which case it's called a total knee replacement, or just part of the knee joint, in which case it's called a partial knee replacement. After having your operation, it can take several months or more to fully recover, and knee replacements can last for 20 years or more, but again, this will depend on person to person. Now, the good news is that having a knee replacement can significantly improve daily life for people who have knee pain, but it is important to remember that this is a major operation and it may take several months to fully recover. Now, in general, recovery for a partial knee replacement should be shorter than a total knee replacement. But again, this is going to vary from person to person, and your own health provider should be able to give you the best advice on which operation might suit you. So first of all, let's discuss some of my top tips to optimize recovery from a knee replacement operation, including recovery in both the hospital as well as when you go home. Starting off with what to do recovering in hospital. So directly following the operation, you'll spend some time in a recovery room where you may be given medicines to help you with your pain. You'll continue to have painkillers in the days after the operation, as your knee will likely be sore. Sometimes if you're in severe pain, the medical team who are looking after you might prescribe you a type of pain relief called an opioid, so things like morphine. Now, whilst these can be good to manage short-term and severe pain, they can cause you to become more constipated, which is why it's going to be important for you to drink plenty of water and try to mobilize as soon as possible after the operation to get your bowel movements working. Now, to do this, you're going to have help from nurses and physiotherapists to start walking soon after the operation so you can go home as soon as possible, and you'll need crutches or a walking frame at first. Now, the physiotherapists will come up with a mobilization plan that is personalized to you. Now, you may also need to see a professional called an occupational therapist if you need some adaptations to your home to help you following the operation. So these are going to be challenges potentially going up and down the stairs or getting in and out of a bath. And the occupational therapists will advise you on what to do, and they may supply you with some specialist equipment to facilitate your full recovery at home. So now let's discuss some of the things that you will need to consider for recovery at home. Now, you can usually go home if your wound is healing well and you can safely get around. Now, most people can leave hospital 1 to 3 days after the operation. Again, this will vary on case-by-case basis. Now, a nurse will take out the stitches or the clips after about 10 days. You'll also have a follow-up appointment about 6 weeks after the operation to check if you're recovering well. So here are my 8 tips that you can consider doing at home to help your recovery. Firstly, use crutches or walking sticks at first. You can go down to 1 crutch, then a walking stick when you feel confident, but stick with the plan that's been given to you by your physiotherapist. Try not to rush things. Secondly, try walking without an aid after about 6 weeks if you feel ready. Now, if you've been told it's okay to mobilize, get up and walk around for 5 minutes every hour to try and prevent blood clots. Fourthly, wait at least 6 weeks to drive again if you've had a total knee replacement, or 3 weeks if you've had a partial knee replacement. But again, check with your own doctor that you're fit to drive. Fifthly, try avoid twisting the knee, bending down, or reaching up as much as possible. Sixthly, always follow the exercises that your physiotherapist has recommended. Number 7, keep your leg raised as much as possible to reduce swelling, especially in the first 48 or 72 hours after the operation. And at number 8, return to work when you feel ready. Now, this is usually after about 6 to 12 weeks, but again, it's going to depend on the type of work you do and how your recovery is progressing. Now, in addition for these 8 things to try and do, there are 5 things that I would recommend you avoid. So firstly, don't sit with your legs crossed for the first 6 weeks. Don't sleep with a pillow under your knee. This is not necessary. Number 3, don't kneel on your new knee until the doctor says you can. Number 4, don't stand for long periods of time because this could cause swelling in your ankles. And 5th, don't do household tasks that involve lifting or moving anything heavy, so things like vacuuming, for the first 3 months. Finally, let's briefly discuss some potential risks because, like any operation, a knee replacement does come with potential risks. Now, the good news is that most people who've had a knee replacement have no complications, and if they do have them, they are typically minor. But the risk of having complications, again, will depend on things like your age as well as your general health. Now, in terms of more serious risks, the surgeon who's operating on you will cover these and explain what they are, but they can include the following things. So first of all, the important thing to be aware of are blood clots or deep vein thrombosis, also shortened to DVT. Now, because of how the blood flows and clots after surgery, there can be a risk of a blood clot forming in the veins of the legs, which may cause pain or swelling. Now, to reduce this risk, your doctor can give you medicines to help thin the blood. These are called anticoagulant medicines. Now, they may also encourage you to wear compression stockings to help with the blood flow and reduce the risk of blood clots forming. Now, sometimes a blood clot that forms in the leg can actually travel to the lungs. This is a potentially serious complication, and this is called a pulmonary embolism. We're going to discuss what the symptoms of this could be a little bit later on in this video. Secondly, there's a small chance that your knee wound could get infected after the operation. This is usually treated with antibiotics, but if the infection spreads deep into the knee joint, then you may need further surgery to clear this problem up. Now, during surgery, there's also a small chance that a blood vessel, a nerve, or a ligament around the knee joint could accidentally be damaged. Now, this is not common, and it can usually be repaired during surgery, or it may heal afterwards. Finally, most people find that their daily life actually improves after a knee replacement operation. However, it is possible that you may have ongoing issues with your new knee. Now, these can include problems bending the knee, ongoing pain, as well as stiffness, and feeling like the knee is unstable when you stand up or walk, which is why ongoing physiotherapy is really important. Now, to end the video, what are warning signs that you should look out for that following the knee replacement surgery that may need a doctor to assess you? So if you recently had knee replacement surgery and you notice a throbbing or cramping pain in your leg, a high temperature, chills and feeling shivery, oozing or pus from the wound, or redness, tenderness, swelling, or pain in the knee that is not getting better or it's getting worse, you should seek medical attention. That's because this could be signs of an infection or, like I mentioned, a blood clot. Now, if you have very severe pain or swelling in the leg and you're having new onset difficulty with your breathing or chest pain that isn't going away, for example, the chest pain is worse when you take a big deep breath in, then you should go to the hospital immediately or call emergency services because this could potentially be a sign of a blood clot that's gone from the legs to the lungs, which is called a pulmonary embolism, which I mentioned earlier. Now, this brings us to the end of the video. I hope you found it helpful and informative. If you did, please do leave me a comment. Consider subscribing for twice weekly medical education videos. And until next time, thanks for watching and bye.